Hi, welcome to the brand new episode of Your Diary. At some point of time, everyone would have felt need for a trained, licensed professional to work out our emotions, feelings and problems that are way out of our control. To assist us on this, we have with us Dr. Meera Sruth.R, Assistant Surgeon, District Hospital, Idukki. Hello doctor, welcome to our show. As I've already mentioned, I don't think in the present scenario there would be anyone who has never felt a panic attack or an emotional outburst or a stress headache. How often do you see these patients in your clinic?
As Dr. Naushin said earlier, adolescent time is a time where you're having lot of chances, challenges, experiments and explorations. During this time, you have lot of explorations, psychosocial explorations, then social stigmas you are facing. So all this will put adolescents into a situation where you have lot of stresses. These stresses can precipitate lot of problems. I think you have lot of problems to ask me. Most welcome.
Exactly. Let's go to the first question.
Hello doc, my name is Jens. I'm working at UST Global and my question is what are the health issues if I'm skipping my breakfast regularly?
Okay, breakfast is an important meal for anyone. It just breaks the fasting period. When you have your dinner, then a lot of time you are sleeping, then you wake up and you have the breakfast. So it just breaks the fasting period. So what is the use of breakfast is that it just replenishes the energy source in your body to give more of glucose to your body, other nutrients, etc., in order to keep your energy up during the daytime. So most of the times these adolescents skip breakfast. Maybe because they are not getting the breakfast, readily available breakfast, or if they are not bothered to take any breakfast, or most of the times what they will do is they will try to be in bed rather than having breakfast.
I'm sure these are very useful tips because smoking is a serious health hazard for everyone. Let's go to the next question.
Hello doctor, my name is Babul and I'm working in UST Global. My question is that what are the side effects of crash dieting?
Crash dieting is something which every adolescent will always try to do. This is because of the negative body imaging they are getting during their adolescent age period, because they will try to imitate, most of the times they will try to imitate some film stars or some role models as they are seeing along with some friends or some role models. They just try to be like them. So what they used to do is just the crash dieting. So crash dieting is something very very problematic one. That can lead to some serious health hazards. Not even immediately, but later they can cause so many problems. The major problem is when you are taking crash diets, your body is deprived of nutrition. So this nutrition deprivation can lead into a lot of problems like early osteoporosis. Most of the teens we are encountering lot of problems like muscle pain, bony pain. They usually came to OPD with lot of such problems. So mainly when we are taking the history from them, they will tell like, doctor, I am just skipping the breakfast, or just I am just taking a crash diet. So the body will not be getting the sufficient nutrition as since they are in a age group where the body is growing both physically as well as mentally.
Doctor, we have received a lot of mail from our viewers. Some are selected. This is the first mail. I am a student and having headache almost all the day. Till now I haven't consulted a doctor. Is it stress induced or something else?
Okay. Headache is a major problem that the teens are encountering. We are getting lot of cases in our OPDs like, doctor, I am having headache almost all the day, so I can't go for my schools daily, so I am getting lot of absence in my school, so I can't concentrate on my studies. So this is a major problem most of the teens are encountering. Headaches may be either a primary headache or maybe due to some secondary causes. The teens are mostly getting this primary type of headache. This primary type of headache mainly contains this stress-induced headache and the migraine type of headache. This stress-induced or the tension type of headache, we can say it is a tension type of headache, can be of two types. It can be either episodic one, that is it occurs less than 15 days in a month, or it can be a chronic type of headache which can be more than 15 days in a month. So whatever be the headache, it is a greater problem for them. You can't point out any cause that is causing your emotional headache, I mean your tension headache or your stress induced headache. You can't point out a single problem, because adolescents having a lot of psychological problems, stresses, that anything can precipitate this. And mostly these headaches are not only associated with headaches only, they can have other problems like dizziness, fatigability and poor concentration, pains at various regions of your body like neck pain, back pain and abdominal pain.